new meaning to the term heavy heart. Welcome back to Western New York Living. If I ask you right now, what are some of the major early warning signs for heart or coronary disease, I'm sure some of you would have a difficult time naming just a few. You're probably not alone. Understanding heart and coronary disease is very important. This morning, we're lucky enough to have Dr. Awad El-Ashry from Great Lakes Cardiovascular join us to give us some great information on this topic. Thanks for being here, Doctor.
Thank you for having me.
Now, many people may not understand what coronary disease is. What is it exactly, and what are some possible signs people may have coronary disease?
So to start off, to take the names out of the equation, the vessels that run around the heart that give the heart the oxygen and the food to keep it going, to keep it pumping, these are the coronary arteries. I always say it's like the pipes carrying the gas to the car engine, so it keeps on going. Over time, we are built to develop the blockages within these within these vessels, and that's because of what we eat, who our parents are, exercise, different reasons. But it happens to everybody to certain degrees, varying degrees over time. The blockages lower the blood flow to the heart muscle, eventually to a critical point where it affects it, and it makes it very hard for this muscle to actually stay alive and keeps on functioning. And then we reach the threshold of a heart attack, where actually part of this muscle dies off. Hopefully we are able to catch this beforehand. That's when our patients come in and say, I'm having chest pain on activity. This means that whatever they're requiring to keep the heart going is not enough during activity. And that's when we try to intervene prior to a major damage happening to the heart.
Well, yeah, it's a great explanation, by the way. I like that the gas feeding there. What are some signs that people should be looking for? You mentioned chest pains, perhaps during exercise or exertion. What are some signs that people should be aware of?
The most traditional is chest pain on activity. And unfortunately, we try to deny the fact that we are getting older and certain things change, and we say it's just because of my age. But if you start, if the patient starts to notice that he is having more shortness of breath that just happened over the past month or two, or some chest pain, or pain doesn't necessarily mean the dull or sharp pain. Sometimes it's just tightness, weird sensation in the chest. Especially if you have family history, then the first thing you need to do is to talk to someone and say, I have this problem. Talk to your primary care, and they have initial tools to identify who needs our help. The earlier we know about these things, the better. We can actually prolong life if we know enough ahead of time. The longer you wait, the longer you stay in denial, the bigger problem it becomes, and we become behind the 8 ball by then.
And some people might be leery of the procedures. Talk about what procedures are available. Some are minimally invasive, and of course, some get more invasive.
Right. Unfortunately, the stigma of the open heart surgery over time and from TV is that it's a death sentence. It cannot be more wrong, because our patients, the overwhelming majority of our patients, more than 99% of them, they actually get out of the hospital on their feet within 4 to 5 days. The least complaint I get after surgery, within a day or two after surgery, is actually pain. Although we do open heart surgery, which involves the traditional way is through the breastbone, opening the breastbone. You would be amazed that only 2 days after surgery, I would ask my patients, do you have any pain? They would say, not really, not at all. And they are on their feet, they are walking around, they are thinking about going home 48 hours after surgery. Usually when they come back to see me in clinic 5 to 7 days later after discharge, they are already looking at this in their rear view mirror. It's a history for them. And they start looking ahead, and their long life is ahead of them.
Yeah, it sounds like you've done a great job, Doctor, and some great information here. And this is important stuff, that people not ignore the early signs of coronary heart disease. Dr. El-Ashry and the staff there at Buffalo General Medical Group are there to help you when it comes to this. And don't ignore those signs. Individualized care that you're looking for. His office is located at 100 High Street in Buffalo. The best place to find out more about all the providers at Great Lakes Cardiovascular is on their website, greatlakescardio.com. Now, coming up next, how would you like to get to your ideal weight just like Gwen did? I'm sure plenty of you are saying, sign me up. We'll tell you how the protein-based weight loss protocol at IDO Weight Loss Center can help you reach your goals when we continue.
This segment of Western New York Living was sponsored by the following: